Hello everyone, and welcome to your first laboratory screencast, which will cover the heart and vascular structures. We'll begin with the heart, and you'll see various illustrations from your Seeley's Anatomy and Physiology textbook. We've also taken some cadaveric images from University of Michigan's Blue Link and Netter's Atlas of Anatomy, and also some other various anatomy textbook and atlases. So we'll begin by talking about some of the layers of the heart. When you first open up the thorax, you will run into what's known as the pericardium. And this completely encloses the heart. It's not open the way we see it in this image, but it is a tough fibrous sac in which the heart is going to lay in. And so if we cut open this pericardium, that's when we're going to see the heart itself. And the heart is made up of myocardium. This is the heart muscle itself, so we know that it is going to be some cardiac muscle. And our last layer will be endocardium, which we don't see in this image here. But I really like this illustration from your Seeley's A&P textbook because we can see that the epicardium, which is your visceral pericardium, will be on this outside layer here. Then the myocardium, which is really thick here, and you can see it's well vascularized, is our second layer. And our third layer is this endocardium. So notice that this is this thin layer sitting against the myocardium, and we will soon talk about what this trabeculae carneae is. So the endocardium is made up of epithelial lining, and we'll find it within each of the chambers of the heart. So here's a cadaveric image of what you can expect pericardium to look like. And here is some of our myocardium. So if you look at this previous image, you can see all of this yellow tissue, and that's really our visceral pericardium or epicardium. And so when we peel that away, we get to see this myocardium. And so there's no fat overlying this. These are the coronary vessels that have been beautifully dissected. So anywhere that we see these fibers running along, that's all myocardium in here. And then here is a cut through your left ventricle, so you can see your myocardium right within here, and then your endocardium would be this inner lining before we see the trabeculae carneae in here. So now we're going to move into discussing some external features of the heart. We have two polar ends here, the base of the heart, where we're going to see some great vessels extending off of. We also have right and left auricles. Right now in this image we can only see the right auricle, and the left auricle would be overlaying the left atrium. So we'll see some images of that later. And then this pointed projection that'll be inferior and pointed toward the left will be the apex of the heart. So let's start off with the base of the heart. When you first have a heart and it's out of the body, you need to really orientate yourself. So the first thing that you want to do is sap the heart, S-A-P. So S is going to be all the way to the right, which is your superior vena cava, and this is draining all of your deoxygenated blood from the upper half of your body. Next we have A. That is going to stand for your aorta, and this is supplying oxygenated blood to the entire body. And then lastly, we have P for pulmonary trunk, and this is going to contain deoxygenated blood within it, and we'll send that over to your right and left pulmonary arteries. So you may have noticed too, as we're viewing these images, you're going to imagine these structures as if they are within a cadaver or a patient. So your left is actually going to be the right. So this side over here is going to be the right side, and then your right is actually going to be the left. So this is our left side of the heart. So let's look at this in a cadaver. Here we are going to have the superior vena cava. It's really this extension. It's a little bit covered by this pericardium here. And then you have your aorta, and you could see that it is curving upward. And then we have your pulmonary trunk in this region over here. So this is just another view where you could see that superior vena cava just a little bit better. And then your aorta and pulmonary trunk. So now let's also discuss your inferior vena cava, right? We can't just have a superior vena cava, and we're going to find this, of course, at the inferior end of the heart on the right side, and this is draining deoxygenated blood from the lower half of the body, and this will head over to your right atrium. So in a cadaver, we can see over here at the black arrow is your inferior vena cava, and at the purple arrow is your superior vena cava, both draining into your right atrium. And if we look at a posterior view of the heart, we can see your coronary sinus. Whoop. So your coronary sinus is right over here. It kind of lies inferior and posterior to your left atrium, and will extend on over toward your right atrium over here to also drain deoxygenated blood from the heart itself into the right atrium. So now you could see your superior vena cava, inferior vena cava, and the coronary sinus all draining into your right atrium. This is also a little image of your coronary sinus. This is from CLE's A&P, draining into your right atrium. So this is an anterior view of the heart, and you can also see the extensions of, these are called cardiac veins, that are all draining the deoxygenated blood from the heart into the coronary sinus in order to move into the right atrium. And this is a cadaveric image of what you can expect the coronary sinus to look like. So this is a posterior view of the heart. You could see some of these beautiful cardiac veins draining into the coronary sinus, and it would move on into the right atrium. So the remainder of the structures that we will be discussing will be discussed via the route of blood flow through the heart. So just as a little reminder, I'm sure you all probably already know this, but we have 4 chambers of the heart. On the right side, we have your right atrium and your right ventricle. And on the left side, we have your left atrium and your left ventricle. So now let's start off with a general overview of how flow of blood will move through the heart. We already mentioned how our superior and inferior vena cava and coronary sinus will drain blood into your right atrium. From there, we'll move into the tricuspid valve, into the right ventricle, and into your pulmonary semilunar valve. From there, we can add pulmonary trunk right in here because that's extending to become your pulmonary arteries and taking all of this deoxygenated blood. So I'm just going to add in, we'll use the color blue. We're going to add in that all of this in here will be deoxygenated blood until we get to our lungs, in which we will be able to turn it into oxygenated blood. So I'm just going to put a D over here, and then let's also use the color red to represent our oxygenated blood. So in the lungs, we are going to get oxygenated blood, and we'll just stop right there. And all of the left side of the heart will have oxygenated blood. Okay, so let's continue on from the lungs here. From the lungs, we're going to move into the pulmonary veins that carries that oxygenated blood into the left atrium, into the bicuspid valve, into the left ventricle, into the aortic semilunar valve, and into the aorta. From the aorta, we're going to deliver all that wonderful oxygenated blood to the rest of the body. The body will use up that oxygen, and then the blood will become low oxygenated or deoxygenated and send it back to the heart via the superior and inferior vena cava and coronary sinus once again. And we'll go through the route. So we're going to look at the specific components at this point, starting off with how deoxygenated blood comes into the heart. Now, whenever we're bringing blood back to the heart, we are going to use venous structures. So a lot of veins here. So our superior vena cava and our inferior vena caval openings, these are going to have the lowest pressure within the body. And then we also have the opening for the coronary sinus. We know that all of these are bringing in deoxygenated blood into our right atrium. So what are some features of our right atrium? If we look at this chamber, we will see that we have this beautiful pectinate muscle, and it's not only within the right atrium chamber, but we'll also find it within our right auricle. So that is that ear-like appendage. Auricle is referring to the ear flap that's going to overlay the right atrium. And the area that is allowing the pectinate muscle to extend into this chamber is called the crista terminalis that we could see in this teal blue color over here. And then the last thing we're going to find here is the fossa ovalis. So let me just point that out before we move on to some cadaveric images. But on our heart, sitting between your right atrium and your left atrium is an area known as the interatrial septum. Inter meaning between, atrial referring to the two atria, and septum meaning wall. So this fossa ovalis is found on the wall between the two atria, the interatrial septum. And we'll take a look at some images as to what this fossa ovalis is, but you'll see that it's oval shaped, and we have almost like a thinning out of the wall in this region. So here's a cadaveric image of what you can expect pectinate muscle to look like. You have these muscle ridges that extend on up, and they all kind of align parallel to one another, and you'll see them extending from the crista terminalis, which is more of this bundular portion over here. And here's another view into the right atrium. You could see the pectinate muscle extending over here, and on this edge where we have the bundle, that's your crista terminalis. So this is just showing us some of the openings of your of the veins. So here's our superior vena cava bringing blood in, inferior vena cava, and your opening for your coronary sinus. Now we see this depression here on the interatrial septum as the fossa ovalis. So let's talk more about that fossa ovalis. So the fossa ovalis is what we see postnatally. When we were a fetus within our mother, we actually had a hole in our heart, and this was called the foramen ovale. So blood would be able to shift from the right atrium into the left atrium. And so as we're born, this has a little flap that will close up this wall and become a depression known as the fossa ovalis. So here we could see it properly closed. Now sometimes this is not properly closed and we get an atrial septal defect, and we could call that a patent fossa ovalis. And I believe there is one on a cadaver, so hopefully we will see that this quarter. So now our deoxygenated blood is going to move from the right atrium through the tricuspid or the right atrioventricular valve. You'll see that these valves have various names, so make sure to know all of them. So here is our right atrium, and we are looking down inferiorly to your tricuspid valve. So in here we're going to see that there are a lot of cusps, and we are going to identify this on this slide here. So here is your cusp, and as you can imagine, this is called the tricuspid valve because we have 3 of these cusps, and extending from those cusps we will have chordae tendineae, so these string-like structures. So these are what's known as your heartstrings, and that is going to attach to a cone-shaped muscle that we will find in the ventricles called papillary muscles. So by these papillary muscles contracting and relaxing, we are able to open and close your atrioventricular valves. So notice too that all of the AV valves will have the same component. They will have the cusps, the chordae tendineae, and the papillary muscles. And these components extend into the next chamber, which is your right atrium here. The other thing that we could see within your ventricles is muscle known as your trabeculae carnae. So we don't see the trabeculae carnae too well. And I think I have a image coming up in your left ventricle where you could see the trabeculae carnae just a little bit better. So once we're in the right ventricle, this deoxygenated blood is then going to move into your pulmonary semilunar valve. And your pulmonary semilunar valve, as well as all semilunar valves, will only have 3 cusps. So you could see at this point we are at the smiley face in our heart. Here was our right ventricle. So we've extended up toward this pulmonary semilunar valve. And so if we were to cut the heart at this level over here, we would be looking down upon over here your pulmonary semilunar valve. And you could see that it has the 3 cusps, 1, 2, and 3. Now anterior to it, you may be seeing this valve over here as well. And this is your aortic semilunar valve that we'll talk about in just a few minutes. So we won't see any chordae tendineae here. We won't find papillary muscles. Instead, we are going to see that they have the cusp, of course, and then the flap known as the lineal, okay, or linealae. And then at the very center of that lineala or pocket-like structure, we have a nodule. So we like to compare this to an actual pocket. So that portion outside the pocket is going to be your lineal. And then imagine that there is a little fibrous nodule right in the center of it. Now, when these 3 cusps come together, those nodules help to close up that center compartment so that blood will pool into the pockets but not go through that center area. So it really does a great job of closing that valve. So now the deoxygenated blood is going to move past this pulmonary semilunar valve and into your pulmonary trunk. Remember, that's the P within our sapping of the heart, and it's really like an extension cord. It just helps that blood shift upward and next into your pulmonary arteries. So we have one right pulmonary artery and one left pulmonary artery. And so if we're looking at our image, we were here at the pulmonary semilunar valve, went into the pulmonary trunk, and now we're extending out through the left pulmonary artery and the right pulmonary artery. So here is an image, a cadaveric image of what this looks like. Here's our pulmonary trunk, and this would be our left pulmonary artery, and then the right pulmonary artery you can't see too well over here. It would be extending posteriorly this way. So now our blood is going to move from those pulmonary arteries into our lungs. So this is a picture of your lungs, and at the area which we call the root of the lung is going to contain our vessels. We'll find our pulmonary artery extending over to the lungs, but also once that blood becomes oxygenated, we are going to move back to the heart through 2 pulmonary veins on each side. So here are our right and left pulmonary veins. You can see in our illustration here, we have the pulmonary veins. These are your left pulmonary veins draining into your left atrium, and here we see the openings to your right pulmonary veins, and you can see the extensions coming off of what would be the root of the lung on this side. So here's a cadaveric image of these structures. This is more of the anterior surface of the heart. Here is the posterior portion of the heart, and so these would be your right pulmonary veins draining into your left atrium, and of course on the other side, so extending to through your screen, would be your left pulmonary veins posteriorly, or I should say posteriorly and to the left. And here's another image. So this is more of a posterior view of the heart, and you could see your full openings. So this is going to be your right pulmonary veins, and we have your right pulmonary veins over here. So now our oxygenated blood is going to move into your left atrium, as we said before. So when we're looking at the left atrium, you may have realized that we don't really have pectinate muscle in here. The only place we're going to have that is within the left auricle. Remember, that is the ear-like appendage that is going to lie right within your left atrium. And so I always get the question, what are your auricles for? And as far as what I've found is that it's just an extra area for storage of blood. So we have this smoothed appearance of the left atrium. So it's still made up of cardiac muscle, though we just don't see those pectinate muscles in here. And so not too many other features here in the left atrium. So where that oxygenated blood is going to go through next is your bicuspid mitral or left atrioventricular valve. And so here you may have noticed that it's not tricuspid anymore, but bicuspid, and bi means two. So we're only going to have two cusps here, whereas your tricuspid would have three. And so because this is an AV valve, we are also going to have the chordae tendineae and the papillary muscles associated with it. I quickly want to mention too that this valve is also called your mitral valve because it was named after a mitre hat, which is the hat that the Pope wears, and you may have noticed that there are two flaps on that hat. So they thought, let's call this the mitral valve because it has two cusps like the mitral hat. Okay, so that moves us into your left ventricle. And you could see here that our myocardium of this left ventricle is 2 to 3 times thicker than in the right. And we can now see a better view of what that trabeculae carnae muscle will look like. So it's almost like a bit more webbing than compared to your pectinate muscle, which has a little bit more parallel ridges to it. And here we could see those beautiful chordae tendineae strings and your papillary muscle here, that cone-shaped muscle. So here's another view as to what that papillary muscle looks like. So now our oxygenated blood is going to move through our very last valve, which is the aortic semilunar valve. And here we are going to see the 3 cusps and the lineae, 1, 2, 3, and those nodules at the very center of the lineae. You may have noticed that there are these little openings here in our aortic semilunar valve that we did not find in the pulmonary semilunar valve. And that's because at the base of the aorta, we will have openings to our right coronary artery and the left coronary artery. So we're going to discuss that a little bit more once we get into our vascular structures. So now our oxygenated blood will move through into your aorta. So here is a superior view of the heart, just to orientate you. Here is our aorta, and this is your pulmonary trunk. And you could see a little bit that there's going to be an extension off of the aorta here that will give rise to those coronary arteries that we just discussed. So your aorta is the largest artery within our body. We will also have the highest amount of pressure because we're pushing all of this oxygenated blood from the left ventricle to the rest of the body. And the aorta has 3 different parts. We have the ascending aorta, and I'm going to switch to another cadaveric picture so you can really see this. So it's this portion moving on up, and you could beautifully see the origin here of your coronary arteries extending off. And then we have your aortic arch. So at this point, moving on up, and I like this picture where the heart has been taken out, but we left a portion of the aorta in place. So this is your aortic arch, and it's giving rise to these arteries here that we'll discuss very shortly. And then it'll extend posteriorly and become your descending aorta. And the descending aorta can be divided into a thoracic aorta and an abdominal aorta. So now we're going to move into our vascular structures. Our illustrations will be from the same sources. And just keep in mind, anytime you see a single A, that stands for artery, double A's are for arteries, V is for a vein, and VV are for veins. So first we'll discuss the arteries of the body. We're going to start off at the aorta, and this is again a superior view of the heart. We could see your aortic semilunar valve and a part of the ascending aorta, which we've mentioned several times now, gives rise to your coronary arteries. So this is going to be your left coronary artery, and over here we have your right coronary artery. And this term coronary actually means crown. So they thought this creates a crown around the heart, just encircling it. Okay. So now let's take a look at the aortic arch. If we look at the heart once again, here is our aortic arch, and branching off on the right side, we will begin with the brachiocephalic trunk. Now we can't see this in this cadaveric image, but off of your brachiocephalic trunk, we will have your right subclavian artery and your right common carotid artery. In the very center of the aortic arch, you will have your left common carotid artery that will head up toward the head, and then you will have your left subclavian artery that will extend and move to supply the upper limb. Now, why would you think that the left common carotid and left subclavian come directly off of the aortic arch, but on the right side we need this brachiocephalic trunk? Then we give off the right subclavian and the right common carotid. So if you guess that this is because the heart lays on the closer to the left side of the body, you are correct. And so I always like to refer to the brachiocephalic trunk as being an extension cord. So if we break down that word brachiocephalic, brachio is referring to the arm, cephalic is referring to the head. And so it's giving off branches such as the right common carotid going toward the head and the right subclavian going toward the upper limb. So here's another view where you can see that branching. So here is your brachiocephalic trunk. Once again, this is coming off the aortic arch, which we would find right in here. That brachiocephalic trunk gives rise to the right subclavian artery and your right common carotid artery. Then in the center of your aortic arch, we have your left common carotid artery. And lastly, all the way to the left of your aortic arch, we will see it give rise to your left subclavian artery. So now let's take a look at some of the branches off of the descending aorta, and we'll come back to those other branches going toward the head and the upper limb later in the screencast. So here you could see your ascending aorta has been reflected so that we can focus on your thoracic aorta. And we call this thoracic aorta because we find this portion of the aorta in the thorax. And so here you're only really going to find extensions coming off called your posterior intercostal arteries. And remember that these can be found within the costal grooves of your ribs. So we would have to peel away some of the parietal pleura that would be found over here in order to see these posterior intercostal arteries. Now if we continue down past the diaphragm, your aorta or descending aorta now becomes your abdominal aorta. And we have a couple major branches that come off here. We have your celiac trunk, which would be this right in here, and we're going to look at these in detail in just a few moments. Then we have your superior, or before we move on to the superior mesenteric, your celiac trunk is going to give rise to your left gastric artery, your splenic artery, and your common hepatic artery. Then as we extend further down your abdominal aorta, we are going to find your superior mesenteric artery that gives off several branches. Moving further down, we have your renal artery. You could see here extending over to your kidneys. And extending further down, we find your inferior mesenteric artery. And at that point, the abdominal aorta will terminate into your common iliac arteries. So let's look at these in a bit more detail. Here is your abdominal aorta. And right at the center over here is your celiac trunk. So it's very, very short, extending off of the abdominal aorta. And the first branch superiorly will be your left gastric artery. And this artery will sit in the lesser curvature of the stomach. Now I know we don't know what that is yet, but we will learn it within your digestive system lectures. And of course, we do have a right gastric artery that is going to branch from another artery and anastomose or come together with the left gastric in this lesser curvature of the stomach. Then we have your splenic artery, and you can't see the full extent of it. It's a very curly, almost like a pig's tail type of artery, and it's going posterior to the stomach here to make its way over to the spleen, which is right over here. And then our last branch over on the right side is your common hepatic artery headed toward your liver. Now you could see here that this common hepatic artery is giving off other branches here, and we're going to discuss that further in chapter 21. Now, if we continue down the abdominal aorta, you will see a single artery extending off, and that is called your superior mesenteric artery. And you could see that it gives off several branches here to supply your small intestines and also the proximal portion of your colon. So we're going to learn all the different portions of your small intestines and colon later this quarter, but you could see all of the beautiful branching that the superior mesenteric artery gives off to give oxygenated blood to the intestines and colon. Here is another view where you can see the branching. Here's your superior mesenteric artery and branching over to those structures. And just another view of this. Now, when we are in the lab, you might not see this fully dissected. Instead, I'm going to go back to this picture here. There might be some mesentery in place over here, which is your visceral peritoneum. And so we have to dissect through this mesentery in order to find these branches off of the superior mesenteric artery to get this beautiful branching that we see here. So now we move past the superior mesenteric artery, and extending off of the aorta, which you can't see too well in this image, would be your renal artery. So here is your abdominal aorta. There's the superior mesenteric artery. And like we said, we're also going to see branching from the abdominal aorta, your renal artery, over to your kidney. So now if we need to drain the kidney, and I'm going to quickly talk about this vein here just because we have this wonderful cadaveric image here, we're going to drain that through your renal vein. So that brings that deoxygenated blood over to your inferior vena cava here. Now you may have noticed in this image that the superior mesenteric artery is almost pinching this renal vein. And so we do have a syndrome known as the nutcracker syndrome, in which this vein does get pinched, and so blood is going to have a difficult time being drained from the kidney into the inferior vena cava. So that brings us to your inferior mesenteric artery. So here's your abdominal aorta. Up here we could see the extension of your superior mesenteric artery going to supply the small intestines and proximal portion of your colon up over here. And then if we follow that abdominal aorta inferiorly, we run into the inferior mesenteric artery. And this supplies the distal portion of your large colon or large intestines, aka your colon, and you could see extensions going down to supply the rectum as well. So at this point, we are going to continue down. Here's your superior mesenteric artery. Here is your inferior mesenteric artery. And at the level of LV4, lumbar vertebrae 4, the abdominal aorta is going to end by bifurcating into your left and right common iliac arteries. So this would be your right common iliac artery, and this would be your left common iliac artery. And so this artery is only about 5 centimeters long. At that point, it's going to bifurcate into internal iliac arteries and external iliac arteries. And of course, these are called the right internal and external iliac arteries over here, and these would be your left external and internal iliac arteries. So I wanted to put this sagittal cut through the body to show you how beautifully the internal iliac arteries branch. So if we look at this image, over here is your common iliac artery, and here's your internal iliac artery. And you could see all of the branching coming off of here is going to go and supply gluteal structures as well as pelvic structures like the urinary bladder and reproductive organs. Whereas your external iliac artery, that's going to continue down to supply the lower limb. And so let's take a look at our arteries of the lower limb. So over here, we just discussed your external iliac artery, and I'll discuss this all on the right side of the body, but know that everything will be symmetrical on the left side. So we have this ligament here. This is known as your inguinal ligament, and it's going to span from your as-is anterior superior iliac spine over to your pubic tubercle. So once it courses deep to this ligament, that external iliac artery will become your femoral artery. Your femoral artery will also give a branch, and I don't know why this isn't perfectly color-coded, but this is going to be known as your profunda femoral artery or deep femoral artery. From there, your femoral artery will extend into the posterior portion of your knee, known as the popliteal fossa, and becomes your popliteal artery. And the popliteal artery will then bifurcate into your anterior and posterior tibial arteries. So there's your anterior tibial artery, and if we follow this distally, it becomes your dorsalis pedis artery after passing your lateral and medial malleoli. Your posterior tibial artery will continue down and give off a branch known as your peroneal artery or fibular artery. So here's a view of the leg. I apologize, these pictures are a little bit blurry, but if you look at the right side of your screen, you will see a posterior view of the leg, and in your popliteal fossa, that popliteal artery is descending on down, and we could see it bifurcate, and it goes above the interosseous membrane that is assisting in holding your fibula and tibia together. So it's moving anterior is your right anterior tibial artery. And this is an anterior view of that artery. So you could see it descending down just lateral to a muscle that we'll soon know as your tibialis anterior muscle. We also mentioned that distally this will become dorsalis pedis. So I should have actually changed the color to this. We'll just use magenta for now. But here is your medial malleolus and your lateral malleolus. So if I were to draw a line going across here from this point down, this is known as your dorsalis pedis artery. Okay. All right. So if we continue down from the popliteal, don't know why I did that. If we continue down from your popliteal artery, we saw that it bifurcated into your anterior tibial artery, and now we will see in the posterior view, the posterior tibial artery. And this will course down the deep posterior leg and just posterior to your medial malleolus. We will find two tendons of muscles we will learn about next quarter, and we will then see your posterior tibial artery. We also have the tibial nerve that'll course along with that too. And then we see our peroneal or fibular branch coming off of that posterior tibial artery as well. And distally, we will see the posterior tibial artery bifurcate into your medial plantar artery and your lateral plantar artery to give supply to your foot. So here's a view of the plantar surface of the foot. This is quite a deep view. And here is your medial plantar artery in the teal, and in the grayish color is your lateral plantar artery. So if you wanted to draw this out yourself, I would start off with your descending aorta showing the bifurcation of the right and left common iliac arteries. We know that your common iliac artery will then bifurcate into your internal iliac artery supplying pelvic structures and urinary structures, and your external iliac artery that will continue to supply your lower limb. And once we pass what this black line is representing, your inguinal ligament, then it becomes your femoral artery. We have that femoral artery giving off a branch called the profunda femoral artery. And if we go back and continue down that femoral artery into the posterior knee, known as your popliteal fossa, it becomes your popliteal artery. And we know your popliteal artery, after leaving the popliteal fossa, will bifurcate into the anterior tibial artery and your posterior tibial artery. The posterior tibial artery gives off a branch known as the peroneal or fibular artery. And this is just a nice little shadow to represent the areas where we would find these arteries. And then that posterior tibial artery bifurcates into the medial plantar artery and the lateral plantar artery. So I just wanted to show you some cadaveric images of what these arteries look like. So here is the upper thigh region, and over here you could see your femoral artery extending on down. Here is the branch it gives off, the deep femoral artery or profunda femoral artery. And you'll also find next to it the femoral vein and femoral nerve. So this area is a space of importance. And so it creates something known as the femoral triangle. So this is the right thigh that we're looking at here. And we have three borders here. We have that inguinal ligament that we discussed, a lateral border that has the muscle sartorius, and a medial border that is a muscle called adductor longus. So these borders create the triangle, and it sits just like this. So in the shadow, you could see the ligament over here spanning from as is to the pubic tubercle. This long muscle down in here, that's sartorius. And this muscle over here is your adductor longus. And so within our triangle, we can find your femoral nerve sitting laterally, femoral artery in the middle, and femoral vein that will be the most medial. So the way I like to memorize this as it's a van, V-A-N, driving up the hill. So you're going to start in the medial portion of the thigh and drive up. V for vein, A for artery, and N for the nerve. So now from that femoral artery, we continue down and it becomes your popliteal artery. So you can see that your popliteal artery here is pretty deep, and sitting superficial to it is your popliteal vein, and then we have a nerve called your tibial nerve. So this is another space of importance known as your popliteal fossa. So we have some borders here. Your superior medial border is made up of two muscles, or tendons of two muscles, semitendinosus and semimembranosus. Your superior lateral border will be made up of another muscle known as your biceps femoris. Your inferior lateral border will be made up of the lateral head of the gastrocnemius muscle, and your inferior medial border will be made up of the medial head of your gastrocnemius muscle. And so this is what the popliteal fossa looks like. Here's semitendinosus, over here semimembranosus. This is your biceps femoris tendon, and here you could see the medial head and the lateral head of your gastrocnemius muscle, or that big muscle that makes up your calf. And so in this popliteal fossa, you will find your popliteal artery deep, your popliteal vein will be more superficial, and the most superficial will be your tibial nerve. Now you may see this other faint nerve extending laterally. That is known as your common fibular nerve, and we'll discuss this more in AMP 3. So if we continue from the popliteal fossa down, we know that it's going to when we follow the popliteal artery from your popliteal fossa inferiorly or distally, we know that it's going to bifurcate into your anterior and posterior tibial artery. And so in this posterior view of the leg, we could see that posterior tibial artery continuing on down. And of course, it's headed for that posterior area of the medial malleolus. With it, will continue the posterior tibial vein. And so if we look at an anterior view now, we know that we were going to bifurcate into that anterior tibial artery from the popliteal artery, and it continues down toward the foot and will lie lateral to the tibialis anterior muscle that has been dissected away in this image here. But over here you could see the interosseous membrane and how it's lying anterior to that. Continuing on down, once we pass the medial and lateral malleoli, it becomes the dorsalis pedis artery. Oh, we forgot to talk about the vasculature that goes toward the head and the arms. So let's go back to that aortic arch, and we are first going to discuss the common carotid arteries. That common carotid artery on the right and left side are going to continue up through the neck and bifurcate into your external carotid artery, which you see it gives off several branches that will go and supply the neck and the face, and your internal carotid artery will continue up toward the head to supply the brain. And we'll discuss more of that branching when we discuss chapter 21 and blood supply to the brain and the circle of Willis. Now if we go to the subclavian artery branches off of the aortic arch and the brachiocephalic trunk, we know that that's going to go to supply our upper limb. So that subclavian artery will become, after passing the lateral border of the first rib, will become the axillary artery. The axillary artery, of course, could be found within the axilla region. There's actually 3 parts to it, but that is going to be covered more in an advanced anatomy course. Once that axillary artery passes the inferior border of a muscle known as teres major, it's going to change its name to the brachial artery. Makes sense because brachial refers to the arm, and we find this artery in the arm. Once that brachial artery passes through the cubital fossa, it's going to bifurcate into the radial artery that will be found laterally in the forearm or toward the thumb side, and your ulnar artery that will be found on the medial side of the forearm or the small finger side. If we look at the hand, you will also see that the radial artery and your ulnar artery are going to create arches known as your superficial palmar arch and your deep palmar arch. Your ulnar artery will create more of your superficial arch or contribute more to your superficial arch, whereas your radial artery will contribute more to the deep palmar arch. And so the way we're going to memorize this is USA, being very patriotic, and so that can represent ulnar superficial arch. And the other thing is RDA, so recommended daily allowance, or we're going to know it more for radial deep arch. So I wanted to show you some cadaveric images of what these arteries look like. In the armpit or axilla region, we have the axillary artery. Remember, once we pass that inferior border of the teres major muscle, right over here, it will become your brachial artery. And you'll see that it also courses with the veins, which we're going to discuss veins very shortly. And once we move into the forearm, we will see that that brachial artery bifurcated into your ulnar artery and your radial arteries. And now we're going to discuss the veins of the body. So there are 2 types of veins within the body. There's actually more, but we're only going to discuss 2 here. And that is going to be your superficial veins and your deep veins. So your deep veins are typically going to accompany the arteries that we just discussed, and they are typically named the same. So your brachial artery has brachial veins that course along with it. So you may have noticed that it's not just one vein that's coursing along with it, there are 2. And this arrangement is known as venae commentantes, or veins accompany. Not all arteries, deep arteries and veins are paired this way. It's more of the smaller muscular arteries, whereas the larger elastic arteries, they will have one large vein that courses along with it. And then our superficial veins are going to be the ones that will course through subcutaneous tissue. So they're the ones, if you look at the back of your hand, you can see them through your skin if you are fair enough. So let's talk about some of the superficial veins within your upper limb. You could see here your cephalic vein. This is coursing up the lateral side of your upper limb and is draining up into your axillary vein, which is a deep vein that will course with the axillary artery. And so here I've put an image of where you would expect to find this on your body. Then on the medial side of your upper limb, we have the basilic vein, and it's showing up in this gray color over here. And you could see it at the number 3 on this body over here. And then sitting between these two, oh, before we move into the next vein, I forgot to mention that your basilic vein will drain into your brachial vein, which is also a deep vein, coursing with the brachial artery. Now, sitting in between these two superficial veins will be your superficial median cubital vein. And this is the vein in which we are going to most often draw blood from. So now let's take a look at what these veins look like on a cadaveric image. We are going to have on the lateral side this cephalic vein that will drain into your axillary vein. You could see it coursing up through what's known as your deltopectoral groove. Delto referring to the deltoid muscle, pectoral referring to the pectoralis major muscle here. And then on the medial side, we can see your basilic vein that would course up the medial side of the upper limb and drain into your brachial vein. And between your cephalic vein and basilic vein and the area of your cubital fossa would be your median cubital vein. Careful not to call this your medial cubital vein. That is going to be points off. So now let's look at some of the superficial veins of the lower limb. We have the longest superficial vein within your body, known as the greater saphenous vein. And this is going to arise from the medial side of what's known as your dorsal venous arch. So you could probably see this if you look at the dorsum of your foot. And it continues up the medial side of your leg and thigh and will eventually drain into the femoral vein within the femoral triangle. Now, if you look at the posterior leg, you will find your small or lesser saphenous vein. And this will arise from the lateral side of that dorsal venous arch, continue up the posterior leg, and drain into your popliteal vein within the popliteal fossa. I wanted to show you some of the deep veins of the abdomen because they don't exactly course along with the arteries that we previously learned. So extending from your splenic vein, you will find this coursing with your splenic artery, but it extends on over eventually to meet with the hepatic portal vein. But you may find these other or may have noticed these other veins draining into the splenic vein. And that is going to be your inferior mesenteric vein draining into your splenic vein and your superior mesenteric vein going to meet with the splenic vein as well. So then that splenic vein drains into the hepatic portal vein, which will extend into the liver. So all of these veins, by the way, are draining deoxygenated, nutrient-rich blood into the liver. So the last thing I want to discuss is coronary circulation. So go back to those coronary arteries that we saw originating off of the ascending aorta. And remember, this is containing oxygenated blood. That blood will then be delivered to the heart muscle itself, or the myocardium. And that deoxygenated blood will move into your cardiac veins, which will drain into your coronary sinus. Remember, that was found on the posterior aspect of the heart, which will drain into your right atrium and will be pumped through the heart, and that blood will become oxygenated again and sent through the coronary arteries. So let's take a look at some of these structures. We didn't specifically talk about your cardiac veins. There's a great cardiac vein, a middle cardiac vein, and a small cardiac vein. So you can see this on the illustration from your textbook here. Here's your great cardiac vein. Your middle cardiac vein is found posteriorly, which is the view, cadaveric view that we see here, that middle cardiac vein. And your small cardiac vein is found on the right side of the heart. And all of these are draining into the coronary sinus to make it into your right atrium. So that is it for our first laboratory screencast. If you have any questions, as always, feel free to contact me via email or phone. So now if we look at